Hello everyone. Hi Natalie, how are you? I'll get started maybe at 7:02. See if a couple people join us. Hi Ellen. Hope you're having a good evening. All right, so tonight I guess I'll introduce myself in case there are people that haven't been here the past couple weeks. So I'm Lindsay. I'm a first year medical student at the University of Ottawa, and I'm from Belleville, Ontario, which is a couple hours from Ottawa, not too far. And the first couple weeks ago, or more than that, a while ago, I talked about stimulating your brain for maintaining cognitive and brain functioning. A couple weeks ago, I talked about balance exercises and fall prevention, as that relates to a lot of other health conditions, so it's good to avoid them in the first place. And this week, I'm talking about managing your health through preventative care, meaning avoiding, again, injury and illness happening in the first place through reducing risk factors and screening and things like that. So, without further ado, I will get started. So healthcare includes two fundamental elements. One being the element that most people would say first, which is treating current illnesses that people have. But preventative care is also really important, meaning preventing illness from occurring in the first place. And there are many different preventative services available, and so those should be used to try to reduce the amount of illness that comes up in the population. And I will be talking about a variety of different strategies that can be used for different diseases specifically. But I first wanted to mention that though preventative care and screening is very good at detecting disease early, there also are some risks that should be mentioned. For example, a common one that we're taught in first year medical school is that, for example, an X-ray gives radiation. So although it may benefit you, there also are some risks. Some other risks of screening are anxiety from false positive tests, overdiagnosis of conditions that wouldn't become clinically significant, meaning that it picks up disease that wouldn't really impact your health anyways, so now you're getting treated for something that didn't really need to be treated in the first place. So whenever I talk about different screening strategies, I just want everyone to keep in mind that though there are benefits, there are risks, so it's just important to always keep those in mind, weigh the risk and benefits to determine whether that would be the right choice for you. So I'm first going to talk about periodic checkups, which is an important part of preventative care. Also, I found most of this information on UpToDate, if anyone's familiar with that. So it is all doctors have, written that, so it should be up to date, as the name of the website suggests. So UpToDate suggests periodic health maintenance visits every 3 years for adult patients less than 49 years old without chronic conditions, and annually for those above 50. Again, this is really dependent on your health situation. For example, though I mentioned that 49 years, it's less than 49, it's 3 years. But say you're less than 49 and you have a chronic health issue like diabetes, then you're going to want more regular visits. So Again, it's super dependent on your own health situation, but those are guidelines for people that don't have any chronic illness. And so now I'll just touch on some specific, well, first I'll ask if anybody has any questions about that. All right, doesn't look like it. So now I'll just touch on some preventative care, in particular body systems, beginning with the cardiovascular system, so our heart and our blood vessels. And so when we think about risk factors for cardiovascular disease, some are modifiable and some are not. Those that are modifiable are the ones that you are able to change. So this includes things like diet, smoking, hypertension, meaning a high blood pressure, high cholesterol, obesity, and physical inactivity. So the best way to reduce cardiovascular disease is to reduce those risk factors. So whether that be, getting exercise to try to lose weight, that's going to work well for decreasing your risk of heart disease or something like that. So hypertension was a risk factor that I mentioned. It is also a risk factor for many other different diseases. So most patients have their blood pressure checked at every primary care visit. And the recommendations for target blood pressures differ based on several different factors, including comorbidities, meaning other diseases that are present. So there's not really a one size fits all. So that's something that you definitely want to talk to your doctor about. But it's estimated that up to 1/3 of cardiovascular deaths may be preventable by healthy diet and physical activity. So it's definitely worthwhile to try to reduce those risk factors to reduce the risk of cardiovascular disease. And it is sort of nice to have something tangible that you can actually do yourself to reduce your risk, rather than maybe relying on other things. So these are steps that you can take today to reduce your risk. And I think some of my colleagues have been talking about different ways to eat well and different exercises and things like that. So those are things that you can incorporate into your lifestyle that will help reduce the risk of heart disease. So now I'll move on to a big one that I think most people think of when they think of screening, which is cancer prevention. So there's many ways that we can reduce our risk of cancer. For example, avoiding tobacco is obviously one that's heavily promoted to reduce lung cancer. Being physically active, again, helps to reduce the risk of cancer, and as well as cardiovascular disease, as well as many other things. So it's always just good to be physically active for overall health and well-being. And in that, maintaining a healthy weight, eating a diet rich in fruits and veggies, whole grains, and low in saturated fats and trans fats, as well as limiting your alcohol consumption and avoiding excess sun exposure, which would be more geared towards reducing your risk of melanoma. Though there's less melanoma here than there is in certain places like Australia. So we have benefit, that's the wrong way of saying it, but our climate helps us out there a bit, but it's also just good to wear sunscreen just to avoid any sunburns and things like that. So I mentioned smoking tobacco is the most important risk factor for lung cancer, and it can also lead to other diseases like cardiovascular disease, as well as it also increases your risk of other cancers like colorectal cancer. So quitting smoking is really the number one way to reduce your risk of lung cancer, or ideally not smoking at all, but quitting is definitely going to be very beneficial for your health. And breast cancer screening typically begins at around 50 years old for those of average risk, and that's with a mammogram. And cervical cancer screening is also recommended for individuals from 21 to 65 years old. From 30 to 65 with average risk, a pap test is done every 3 years. And for those over 65 with average risk, if you've had adequate negative prior screening, meaning that you've had 3 consecutive pap tests within the last 10 years, then no further screening is needed. However, if you haven't had 3 consecutive negative pap tests in the past 10 years, then you have to consider screening for cervical cancer beyond 65. And just reading a comment that smoking is a huge risk for our health. It really is, not just for lung cancer, but I feel like pretty much most of the diseases that we've learned about in first year medical school, smoking is often a risk factor. So it's just really good to quit for your overall health and well-being. All right, and so yeah, those are the screenings for breast cancer, cervical cancer. Does anyone have any questions or anything about that? All right. Now, screening for colorectal cancer really depends on your risk factors. So again, these are all things that you'd also want to talk to your physician about. Some other important preventative care modalities, for lack of a better word, are immunizations, which is a very hot topic right now. But vaccination is really a great way to prevent illness, not only for yourself, but for your community. So UpToDate recommends getting the annual influenza vaccination for all adults. And you should also receive a booster for tetanus every 10 years, your zoster vaccine, for those over 50, and that's to prevent shingles, as well as your pneumococcal vaccine, as recommended for adults over 65. By risk factor, yeah. So good question. By risk factor, are you including genetics? So oftentimes our risk factors do include, pretty much all the time, your genes and your family history and things like that. I haven't really mentioned that only because difficult to modify your genes, actually impossible. So it's although it's definitely good to be aware, the ones that are modifiable are definitely going to be the ones that you're wanting to look at further. But definitely genes, family history, personal history of cancer are also big risk factors as well. But that was a really great question. So yes, it's important to get vaccines as well to reduce illness, and also we've seen that with the COVID-19 vaccine as well, and how it's been effective at reducing illness as well as reduce the severity of illness. So it's good to keep in mind COVID as well as your annual flu vaccine, your vaccine for pneumonia, and things like that. And I also wanted to briefly mention just getting checkups with your dentist and optometrist. So getting your teeth and vision checked regularly. Dentists and dental hygienists can check for mouth cancer and gum disease. They also remove plaque and tartar, which contribute to tooth decay as well as gum disease. So it's just good to maintain dental hygiene, because not only does that impact your dental health, but it also could have impacts on your overall health as well. And similarly, visiting your optometrist regularly. An eye exam will involve a series of tests just to evaluate your vision as well as check for eye disease. So again, very important to get that checked because, one, to look for eye disease, which is very important, but even just getting your vision checked, having 20/20 vision or close to can help reduce falls, like we talked about last week. So not only does it impact your eye, but it could also impact your overall well-being, similarly to dental health. And so regular eye exams just give your optometrist a chance to correct those vision changes and reduce falls and things like that, as well as detect eye problems at their earliest stages, which help improve treatment outcomes, as well as just provide tips for caring for your eyes. So that's a lot of different aspects of preventative care, preventative medicine that we've gone over. And I just want to bring back to the beginning when I talked about also the risks of these preventative screening tests. For example, overdiagnosis leading to treatment of not clinically significant disease or anxiety from false positives. It's just always good to keep risks and benefits in mind, not only in medicine, but probably in everything. And just sort of a summary of what I think is probably the most important was that just the up-to-date suggests periodic health maintenance visits every 3 years for those that are under 49 years old and don't have any chronic conditions, and annually for those above 50. So speaking with your doctor is really the best thing to do. And that was sort of the blurb that I had about preventative care. Does anybody have any questions with any of that or anything that I could repeat? I'm happy to do that. And those are only I only mention, a small portion of what's out there, so there's definitely lots of different screening techniques that you can do. Important to have regular doctor visits, definitely. They'll know best, so it's always good to see your doctor. All right, so if there are no questions, I just, though it's hard to do actual screening tests, particularly because I'm a first-year medical student, I did find a sort of fun color blindness test, which isn't totally related. However, it's sort of interesting. Just a comment here, I get my eyes checked every second year, but wondering if I should do this annually. I think that's definitely something that you could talk to with your optometrist. I'm not exactly sure, and it's also, I imagine, very dependent on your individual health situation. So definitely, if you're wondering, your optometrist would be the best one to ask. But important to get your vision checked for a variety of reasons. All right. So I'll start with the color blindness test, and I'm hoping this will work. I'm just going to show this screen, so it may not work, but let me know. You don't have to put what you think it is in the chat or anything, but maybe just write it down or try to remember. My memory's not that good, but if you can do that, by all means. But otherwise, you can grab a piece of paper or something, or type it on your computer. Okay, so hopefully this, oh yeah, it works. All right, so this is the first one. So if you're just able to write out what you see on the screen. And I'll just hold it for 30 seconds maybe. All right, so that's the first one, and I'll go over what they are at the end. And this one. All right. And number 3. All right. Here's number 4. All right. Number 5. Number 6. Number 7. Number 8. A couple more. And number 9, this is the last one. All right, so hopefully everyone saw those okay. If you didn't, please comment and I can share, show one. But otherwise, I will go over them. So yes, this is called the Ishihara test for color blindness. So there are different numbers within the circle that are different colors in the background. And so ideally you should be able to pick out the numbers from the image. So number 1 was 12. Number 2 was 6. Number 3 was 45. Number 4 was 74. 5 was 2. 6 was 3. 7 was 97. 8 was 42. And like Natalie said in the comments, the last one, number 9, was no number. So also good to be able to pick out when there's no number as well. And number 8 was 42, yes. Yeah, so hopefully that went well for everyone. Not really the screening and preventative care that was mentioned, but it is sort of a screening test for color blindness, and it's also sort of fun, and I think that the circles are pretty. Yes, no number for the last one. So if you didn't see a number for the last one, there's no worries. there wasn't a number for that one. So that's perfectly appropriate. All right, so that's all for the color blindness test. Now I had, similar to last week, I thought we would go through some, got on late, but we'll look after. Okay, great, yes. They are pretty, I find that test sort of fun to do. So hopefully it will be enjoyable afterwards as well. So I thought, I thought similar to last week, I could end with doing a couple brain teasers, because like I mentioned last week as well, it's good to try to build those habits over time. So I thought if we do it every time we meet, then all the better. So I thought I'd start with a couple anagrams, which are just when the letters are sort of jumbled up into different, the letters are jumbled up, but you can unjumble them and make a word, if that makes sense. So I thought I would start with one that is a cartoon character. So I will post it in the comments, the anagram. And so this actually can rearrange into a cartoon character name. So hopefully everyone can see it. It's called, or the word or phrase is brownie larch. So that can rearrange into a cartoon character's name. Is anyone able to figure that out? I'll give a while, maybe a minute or two to figure that, to look at that. I find these very hard. Sometimes they're in the newspaper and I can't do it. Wow, so fast. Charlie Brown. Yes, that's it. Good job. That didn't take nearly as long as I was anticipating. Okay, so I have another one. Again, a cartoon character. I think this one might be a bit harder. We'll see. So, morphism nose is the clue, and that can rearrange into a cartoon character name. But I think this one's quite challenging. Yeah, that one's hard. So this, I'll give the answer if that's good with everyone. So this one rearranges to Homer Simpson, which is pretty difficult. A lot of letters in that name to rearrange. And maybe I'll do one more. So this one rearranges to a popular actor's name. So it's Monk's Hat, I guess is how you might say that. And yes, so that one rearranges into an actor's name. Yes, Sophia, you got it. Brilliant, just brilliant. Yes, Tom Hanks is also one of my favorite actors. I couldn't tell you my favorite movie from him. Forrest Gump is a classic. I also enjoyed Captain Phillips, but they're all very good. Sleepless in Seattle is also a classic. Yeah, Tom Hanks is great. So, I think that's all of them. If anyone has any last minute questions, I'd be happy to try to answer them. If not, I hope everyone has a really great evening. And it was great to speak with everyone again this week, and I'll be back in a couple weeks. All right, doesn't look like there are any last minute questions. So bye everyone, have a great week, couple weeks. Thanks, Ellen, bye.